If you're a clinician, you absolutely need to get a handle on medical negligence. In this explainer, we're going to give you a simple, clear framework, not just about the legal theory, but about how you can use these principles to practically protect your practice. Let's get started. Okay, so here's how we're going to break this down. We'll start with the 4 pillars of negligence. Then we'll dive into each one. What is a duty of care? What counts as a breach? And how do you link that breach to actual harm? And finally, we'll wrap it all up by turning this legal stuff into practical risk management you can use every day. So, medical negligence, it really all comes down to 4 key things. 4 pillars: duty, breach, causation, and damage. And here's the kicker. For a claim to actually succeed, a patient's legal team has to prove all 4 of them. If even one of those pillars is missing, the entire claim falls apart. Let's see how each one works. All right, let's jump into that first pillar, duty of care. This is really the bedrock of any claim, right? The big question here is, at what exact moment does your legal and professional responsibility to a patient actually kick in? So, what is a duty of care? Well, think of it as your legal obligation to a patient. And it's not some vague idea. It's a real responsibility that begins the very moment a doctor-patient relationship is formed. From that point forward, you are legally required to provide care that meets the accepted medical standard. Now, you might think this relationship only starts with a formal appointment, but it's actually much broader than that. It can begin the moment you give any real clinical advice, even online. It starts when you perform an examination or, of course, respond to an emergency. And yep, if you're on call, you have a duty to anyone who might need you during that shift. Now, this is a really, really important point to remember. The law isn't asking for perfection. No one expects you to be flawless. What it requires is reasonable competence. The standard is simply the level of care that another clinician with your same skills and qualifications would have provided in a similar situation. Reasonable, not perfect. Okay, let's move on to our second pillar, breach of duty. So once we've established that a duty exists, the next question is pretty straightforward. Was that duty breached? Did the care you provided fall below the accepted standard? So, what is the standard of care we're talking about? Well, it's the legal yardstick your actions are measured against. Think of it this way. What would a reasonably competent practitioner in your same specialty have done in that exact same situation? That's the standard. It's usually figured out by looking at professional guidelines, expert testimony, and established clinical protocols. And in the real world, a breach can look like a lot of different things. It could be something like an incorrect or delayed diagnosis, maybe a medication error, or a mistake during surgery. But it can also be things like not monitoring a patient closely enough, failing to get proper informed consent, or not referring a patient to a specialist when it was clearly needed. Okay, this next point is probably the most critical distinction in all of negligence law. A bad outcome does not automatically mean there was negligence. It just doesn't. Medicine has risks. We all know that. A patient can have a known complication or their disease can progress no matter what we do. Negligence isn't about the result. It's about a deviation from the standard of care, like failing to follow protocol or ignoring obvious red flags. And that brings us to our last 2 pillars, causation and damage. You see, it's not enough for someone to just show that a mistake happened. To prove negligence, they have to draw a direct line from that specific mistake to the actual harm the patient suffered. The idea here is pretty simple, really. There has to be a clear, unbroken link between the breach of duty and the patient's injury. If the patient would have suffered that same harm anyway, even if the care had been perfect, then that legal chain of causation is broken. So, how do courts figure this out? Well, they often use something called the but-for test. And you can ask yourself this question. But for my action or my inaction, would this harm have happened? If the answer is no, well, then causation is likely there. All right, last pillar, damage. For any claim to go forward, the patient has to have suffered what the law recognizes as damage. And listen, this isn't just about being unhappy with the result. We're talking about real, tangible harm, like a physical injury, a condition that got worse, significant psychological distress, or even financial losses that happened because of the breach. And this is another key point. The bar for what counts as damage is pretty high. Just being dissatisfied or having some minor discomfort that goes away, that's not going to cut it for a negligence claim. The harm has to be significant, and it has to be demonstrable. Okay, so we've gone through the legal theory, Now for the really important part. How do we turn all this into a practical framework you can use every single day to manage your risk and protect your practice? So let's just flip those 4 pillars around and turn them into your defensive strategy. For duty, make sure you establish it clearly. Document every consultation and the scope of treatment. To avoid a breach, stick to the guidelines and communicate all the risks. To protect yourself on causation, document your timelines meticulously and, just as important, document any patient non-compliance. And for damage, make sure you're documenting all outcomes objectively, using clinical findings, not subjective language. Look, if you only take one thing away from this entire explainer, let it be this. Good documentation is the single most powerful defense you have. Your notes aren't just for patient care. They are your primary legal shield. Clear, objective, and timely notes are everything. All right, let's quickly tackle 3 common myths that can get clinicians into a lot of trouble. Myth number 1, a signed consent form does not give you a free pass for providing substandard care. Number 2, if you decide to go against a standard protocol, you better have a very good reason, and you better document that reason clearly. And finally, I was too busy or we're short-staffed. Those are almost never accepted as a valid legal excuse for a breach of duty. So I'll leave you with one final question to think about in your own practice. Just imagine if someone, a lawyer, another expert, had to piece together a patient's entire clinical journey using only your notes. Could they? Would your documentation tell the complete, clear story? Is it truly strong enough to be your best defense?
Your med lawyer, protecting doctors, empowering patients.